Hello and good afternoon. Welcome to today's COVID-19 update with the county's public health experts, coming to you from the safety of their private offices. Today, you will hear from the county's Director of Public Health, Dr. Vaughn Do Reynoso, and Dr. Henning Ansorg, the county's Public Health Officer. Following their updates, we will open it up to questions from the news media. As a reminder, this press conference is being interpreted in Spanish by Carlos Saracedo and in American Sign Language by Julia Townsend. Videos of the press conference will be available shortly after the conclusion in English and Spanish on the county's YouTube channel at CSBTV 20. And with that, I will turn it over to County Public Health Director, Dr. Vaughn Do Reynoso. Welcome, Dr. Do Reynoso.
Thank you, Gina. May I have my slides? Great. I'd like to begin this press conference by sharing with you the pending transition to a third-party administrator that will happen mid-March in our county. So currently, as you may recall, the state of California gets our vaccines from the federal government. And also want to note that the federal government has partnerships, direct partnerships with pharmacies who are vaccinating long-term care facilities as well as the general public. So the federal government sends a set amount of vaccines to the state of California. The state of California, based upon our demographics and in the methodology, will allocate a set number of vaccines to all jurisdictions. So there's 61 jurisdictions, and Santa Barbara County Public Health Department is one of those jurisdictions. So currently, the Santa Barbara County Public Health Department receives the allocations from the state on a weekly basis. We in turn meet with our allocation committee, and we distribute the vaccines to community providers, as well as we keep some, roughly around 19% on a weekly basis, to vaccinate community members at our public community vaccination sites. So together, our public health department and our community providers vaccinate the entire Santa Barbara County residents. So mid-March, when Blue Shield of California becomes the third-party administrator for our county, that will all change. The state will give its allocation to Blue Shield of California. Blue Shield of California will be the authority, the authorization party, and they will be allocating the vaccines to the public health department, to our pods, and directly to our community providers. So allocations in March will not come from the public health department. It will come from the Blue Shield in our community. And so the rest is the same. We, together with our providers as partners, will continue to offer vaccines to our county. Next. I'm happy to report that we, as of today, have received 61,000 doses received. An amazing, amazing achievement. In our county, we have administered 99% of the doses that we have received. And that is a huge, huge celebration for our community. And I want to pause and thank our public health team, our fire department, and the numerous volunteers who are working at our 21 community vaccination sites. So we've ran 21 community vaccination sites so far. I also want to thank all of our vaccine providers as well for their efforts in vaccinating our community. Next. So we are currently vaccinating everyone in phase 1A. which means the healthcare workers as well as community members who are 75 and above. However, I'm happy to announce that starting February 16th, we will move to vaccinating adults 65 years and above. So what that means is residents of Santa Barbara County who are age 65 and older will be eligible to receive their first dose of the COVID-19 vaccine. This expanded eligibility means that the local health providers, pharmacies, hospitals, and public health vaccination sites can open appointments to those 65 and above once the vaccines become available to them. And again, even though we are moving to the 65 plus, we are still very limited in the number of vaccines that we get as a county. In addition to that, California officials today announced that people between the age of 16 and 64 who are disabled or at high risk for morbidity and mortality from COVID-19 will be eligible to be vaccinated beginning next month on March 15th as vaccine becomes available. And the underlying conditions explicitly stated in the guidelines include cancer, chronic kidney disease, stage 4 or more, chronic pulmonary disease, Down syndrome, immunocompromised immune system from solid organ transplant, pregnancy, sickle cell disease, heart conditions such as heart failure, coronary artery disease, severe obesity, and type 2 diabetes mellitus. And so the state also broadly defined eligible individuals in this category as those who are likely to develop severe life-threatening illness or death from COVID-19 infection, or are limited in their ability to receive ongoing care or services vital to their survival. So the situation is expanding. So we will be moving again towards appointments for adults age 65 starting March 16th. And we know that the state has authorized on, I'm sorry, let me start over. So starting February 16th, adults 65 and above can get appointments, and starting March 15th, the ages 16 to 64 who are disabled and have comorbidities can also book appointments. And after that, we will move to the rest of phase 1B, which is the emergency services, the food and ag workers, and education and childcare. And I do want to pause there and mention that for entities who are receiving direct allocations from the state or the federal government, so these entities could be the MCEs, which are multiple entities in different counties. Here in our county, it is Marion Regional Medical Center and UCSB. They currently receive separate allocations from the state. They may move they may move towards a pilot basis to vaccinate those in phase 1B, such as the emergency services, the food and ag workers, and education and childcare. Next. So with regards to our moving towards vaccines for residents aged 65 to 74, I just want to ground us in reality. So currently we get an approximate 6,000 vaccines a week. However, we have an estimate of roughly 41,000 residents aged 65 to 74. So the takeaway is that vaccine supplies are still very, very limited, and healthcare providers are also currently simultaneously ensuring that those who have received a first dose will also be able to receive a second dose. So we just want to encourage everyone to be patient. We have a lot more people than we have vaccines for. And we ask that until vaccine supply increases, the community allow those who are at the greatest risk for exposure and serious health outcomes to allow them to make their vaccine appointments first. Next. So this graph describes again our rough estimates of vaccines versus population. And although we are excited to open appointments to vulnerable community members to have their first access to vaccine, we are continuing to make progress in vaccine administration, as I shared earlier, based upon what we receive from the state. Things are pretty tight still with the 6,000 total first doses. I know that there are community members in the childcare and education field, and there are food and agricultural workers, and there are community members in the emergency services who are also anxious to get the vaccines. However, just wanting to underscore that with 6,000 total first doses, we are really limited. And I wish we were in a space to be able to allow everyone a vaccine who wants one. And I am encouraged, though, that from the federal government, some assurances, some hopeful projections that in 5 weeks, we will be in that space where everyone who wants a vaccine will be able to get one. So we just want to encourage everyone to hold to that hope and be patient as we navigate the limited vaccine allocation to our county. On that note, I want to also share that our 211 and the county call center have been experiencing an exceptionally high call volume recently. And this has resulted in long wait times as well as an extended busy signal. We are working to make the system improve the system, which includes increasing the call center staffing, allowing callers to have a shorter wait time. When we do that, we hear and understand the frustration people are experiencing, the anxiety people are experiencing. We understand that there are many questions about vaccines at this time. So please know that we are working as fast as possible to make these improvements as the high volume of calls continue. Next. I'd also like to introduce something brand new to our community, and this is the debut of our COVID-19 vaccine dashboard. And I want to thank our EPI team and Legacy Works being our partners to make this happen. It was a lot of heavy lifting from our EPI team to be able to scrub the data that we have received from our providers and the state to bring you the data that you've been asking for. So this will be live on our website after the press conference. On this dashboard, we are describing doses administered by age. We are describing doses administered by race and ethnicity, as well as doses administered by gender. And so I want to share with you that these are, this is the data pertaining to all of Santa Barbara's residents, regardless of where they may have received their vaccinations. We also describe the second doses administered by region. We also describe to our community members the number of vaccines that we have been allocated, the number of vaccines that we have ordered, and the number of vaccines that we have administered. And we, in the bottom right-hand quadrant, we also share the percent of population fully vaccinated by region, North, Central, and South. On the bottom of the dashboard, we share information on first doses administered, second doses administered, and total doses administered. And so this is information that our community has been asking for, and we are so happy that we are able to provide this to you. Next. I'd like to end by encouraging all of us to continue doing something effectively. Remember to vaccinate when it is your turn. So when you are wearing a mask, remember to wear it correctly. Definitely wear it when you are inside or when you are in close proximity with others. Watch your distance. Please remain at least 6 feet apart. Remember to wash your hands and continue to wait on gathering. Limit the amount of gathering that you do. If you do gather outside, gather with less than 3 households, and gather in the least amount of time possible. With that, I want to say thank you for your support. Thank you for your patience. Stay safe, and introduce you to Dr. Ansor, our County Health Officer.
Thank you very much, Dr. Do Reynoso. Good afternoon, everyone. I would also like to acknowledge that we as the Public Health Department understand that the challenges with the rollout of the vaccine has caused a certain degree of anxiety and frustration for many residents. Despite our best planning efforts, we were confronted with an unexpected and significant shortage of available vaccine supply across the whole country. This shortage made it necessary to prioritize the most vulnerable population to receive the vaccine first. These difficult first 2 months could have been averted if the government had indeed secured and shipped the number of doses they had promised. We had prepared according to their promises, and we had the necessary infrastructure, personnel, partnerships with hospitals and clinics, everything in place to administer at least triple the amount of vaccine that ended up being available. Fortunately, by now, the production and securing of sufficient vaccine is ramping up nationally. Within the next 3 to 4 weeks, we also anticipate that a new third vaccine product will become available in the United States. This new vaccine, manufactured by Johnson & Johnson, will require only 1 shot, and it does not need sub-zero storage conditions. Its efficacy in the trials looks very promising. Having sufficient vaccine supply at our disposal will eventually make it possible for any person over the age of 16 who wants a vaccine to receive it in the United States. Dr. Fauci announced that this could be a reality by the end of April. For Santa Barbara County, we are already noticing that more vaccine opportunities are becoming available. For example, as of yesterday, some additional vaccine supply is coming directly to local pharmacies. 2 pharmacies in the first week are CVS in Santa Maria and a CVS in Bhutan. The allocations of vaccine come directly from the federal government, and there are plans in place to include more local pharmacy locations in this new program over the coming weeks. In addition, our community health care centers are slated to receive vaccine supply directly from the federal government as well. This will help greatly to reach out to our under-resourced communities in the county. The California-wide rollout of a new vaccination sign-up platform called My Turn, in conjunction with a new partnership with Blue Shield of California, will streamline and optimize the vaccine supply chain and the speed of the administration of the vaccines. Santa Barbara County is slated to go live with this particular change in mid-March. We are very optimistic that all these new efforts combined with more available vaccine supply will solve our current bottleneck situation in a matter of weeks. Please, in the meantime, remain patient and stay tuned for our regular updates on new vaccination opportunities. At this point, we continue to see, after 61,000 doses given, that the vaccine is tolerated really well overall. Some people experience short-lived vaccine reactions, like headaches, soreness at the injection site, fever, or chills. But remember, these reactions are expected and will go away quickly. Similar reactions do occur with other vaccines as well. They are actually a sign that our immune system gets stimulated to produce antibodies against the virus. At this point, I would like to address the question of which masks are best. There's a lot in the press about double masking, masking in general. Now, I want to take this opportunity to show you again. These masks are called N95 masks, and ideally, they are fitted because they come in different sizes. They are designed for healthcare workers, obviously, to protect the healthcare worker when taking care of an infectious person. In the beginning of the pandemic, we had to ask everybody to abstain from trying to purchase these because there was an international shortage, which since has resolved. So these masks are now also available for purchase. But be advised, they have to fit very snugly over the nose with a good seal so that there are no air leaks in order to provide optimal protection for the person who wears them. Now, there are so-called procedural or surgical masks. They are thinner, they have folds, you have seen them, and they were designed for protection of my surroundings from the wearer's respiratory droplets. For instance, as a surgeon, you don't want to contaminate the operation area. Now, this is very good to protect my surroundings from my own respiratory droplets. However, the protection it gives to me from other virus carriers depends on how tight this thing fits. As you can see, there's some suboptimal fitting here over my cheeks. Now, many people have found a solution by just putting another cloth mask, for instance, on top of it to get a tighter fit. I leave that up to you. Sometimes it can make it helpful. Some people have been able to double two of those masks and therefore get a tighter fit around the nose, cheeks, and chin. Now, I would like to switch gears and talk about our local rates. When I look every day multiple times at our local epidemiological data, as you can imagine. And when I looked this morning, I was really excited because our local case rates and our positivity rates in our testing has finally really come down. This is a great relief to all of us. But please stay vigilant with social distancing, mask wearing, and all the necessary requirements to make sure that this downward trend continues on this great trajectory. Everybody's responsible behavior will make us all safer, and it will open up our schools again so that our children and youth can get the education and mentoring that they so desperately need, crave, and frankly deserve. Thank you for your cooperation.
Thank you, Dr. Ansor and Dr. Do Reynoso. And now we're going to open it up to questions from the media. We have several in the queue. First up will be Tom Bolton with NewsHawk, followed by Blake Devine with KYT.
Thank you very much. I have a few questions today. Obviously, there's been a lot of talk about the vaccine supply, and we've seen or heard on the national level that the vaccination rate has gone from roughly 1 million a day up to 1.6 million a day. I'm wondering what the outlook is specifically over the next few weeks. Seems like we've been at that 6,000 dose for a while now. What are you expecting that to be a week from now, a month from now, et cetera? Can you give us that information?
Yeah, I'm happy to.
Go ahead. You could start. I'll finish.
Okay, I start and you correct me if I'm wrong. So, Mr. Bolton, I think these extra doses have made it possible for the federal government to basically give those vaccines to the pharmacies, to these community healthcare centers, and they are also now starting mass vaccination sites. You may have read in the press that in California, Los Angeles, and Oakland will both open up a FEMA, which is federal, of course, FEMA organized mass vaccination sites this Monday. And once they're fully operational, they will vaccinate 6,000 people a day each. So the federal government is able to give the vaccines out because there is more supply available. But they have not necessarily increased the supply to the individual states quite as significantly yet. But that can change in a matter of weeks, of short weeks.
So you don't have a specific expectation at this point in terms of what that might be?
Honestly, I do. My expectation is that the state is waiting for this new system that is implemented in waves. And Santa Barbara, because we are a relatively small county, we are not the front runners. So we will lag behind a little bit. Bigger areas, other areas will start sooner, basically by next week on this My Turn system, and also with the Blue Shield being basically the logistical machine behind the whole effort and supplier of the vaccination. And I think once we are onboarded there, our receipt of doses will go up exponentially.
Okay, thank you. We're about to embark, or you're about to embark on a much larger cohort of 65-year-olds plus. Can you tell us where we stand in terms of vaccinating the 75-year-old plus group?
Yeah, we've covered at least 2/3 of the 75 plus. It's sometimes difficult to know exactly because some may have an appointment at Sansom and at Cottage. And eventually, because the appointment wasn't soon enough, got the vaccine at a pharmacy. So sometimes it is very difficult to know exactly who has received their vaccine, who will cancel their appointment. But from the estimates that we have, we believe that we have vaccinated 2/3 of the 75 in Santa Barbara County.
Okay, and do you have a target for doing, I mean, that's only 2/3. Do you have a target for getting that to a higher number?
Well, 2/3 is really good because you have to understand that not everybody wants a vaccine. So in the nursing homes, for instance, where most people are over 75, we saw that 70% more or less wanted a vaccine and 30% declined to be vaccinated. So we just leave it open for anybody who changes their mind or hasn't had a chance to get the vaccine and is over 75 anytime. Doesn't mean they can't have it anymore. Anytime they call, they're still eligible to get it as soon as possible.
Okay, thank you. I had an unrelated question. A couple of weeks ago, I asked about a church in the Santa Maria area that had continued to meet indoors and essentially ignoring the guidance in terms of masks and social distancing, et cetera. And I sent you an email earlier today because I've gotten several questions from people about gyms in the Goleta area that appear to be operating indoors in violation of the public health order. And I'm just wondering, is there really any, result to them to do that, or any action being taken? Because folks have told me they've made complaints and it's persisted for weeks.
Thanks, Tom, for the follow-up question on that. So I did check on the church that you mentioned, and our record shows that it operates within the city, and we have forwarded that information to the city code enforcement. So the ball is in their court. With regards to the gyms, we are aware of the gyms that you have mentioned, and our enforcement team is working with our DA's office and other entities to address the issue.
Okay, so I mean, can people expect there will be some sort of action taken? Because it feels to people who see the problem like basically there's no repercussion.
I think that you can expect some form of action in the near future, and we are planning to update our board at our next board hearing on enforcement activities.
Alrighty, thank you very much.
Thank you, Tom. And next up, we're going to Blake Devine.
Hi guys,
Okay,
first question for me, very simple question. Do you guys know offhand how many weeks we were stuck in phase 1A with us moving into phase 1B starting next week?
Just shy of 2 months. We started right before Christmas, and we're officially opening up for the next phase on February 16th. So just 2 months, 8 weeks.
Makes sense. With the move into the next phase, I just want to clarify the sector populations, they will not be able to be vaccinated. It'll just be 65 and older for now. Is that correct?
That is correct. So we are opening up appointments. Again, I just want to underscore that we still have severe limitations on the number of vaccines, but our providers will start offering appointments beginning or starting February 16th to 65 and above.
And is there any anticipation for when we might be able to expect those sector populations like education and all those other ones listed? Education, emergency services, food, when would we maybe be expecting those to be able to be vaccinated?
And that's a really tough question. We are ready. We want to vaccinate our workers in the emergency services, our ag and our food workers and our teachers and our childcare providers. We absolutely want to do that. But how do we do that given the 6,000 doses that we have each week? It's impossible. So we know that our MCEs, so our UCSB and Marion will receive their separate allocations and may start pilot projects with these groups that I just mentioned in the near future.
And then just to clarify, is it 75,000 residents in the 65 to 74 age range?
I can verify for you if you give me a second. So we are, it's 40,000. So roughly we can round up to 41,000 in the age group of 65 to 74.
41,000. Okay. Thank you. So other question, kind of moving subjects. We have multiple reports of people who do not currently meet the criteria that have been able to get vaccinated with no shows at some various locations. Other counties, they've set waiting lists to ensure that the vaccine goes to those who need it first. What exactly is the policy for vaccinations and no-shows and extra doses?
Well, that depends solely on the vaccination site and on the time when the vaccination clinic is wrapping up. If at the end of the day, unexpectedly, even though they have a waiting list, some appointments were canceled or there were no shows, which is rare. We, by all means, want to avoid any wastage of vaccine. And then there could be a lucky person who shows up and is lucky enough to be able to receive the vaccine, even though they're actually not on the list of eligible providers, just recipients, just because of the time it would take to get somebody in. Sometimes we're talking half an hour, and within half an hour, a couple of doses or so have to be used up, or they have to be wasted. And that's what we absolutely want to avoid. And you will hear anecdotal reports like that, but it is absolutely not the norm. So if somebody shows up at our point of distribution site and their ID says they are not eligible, they will be turned away. And so it is really these anecdotal reports that make sound bites on the news, but it's really not the norm.
Makes sense. All right. Thank you guys so much.
Thank you, Blake. And next up, we're going to Brooke Holland with NewsHawk.
Hi, yes, thank you. I have a few questions about masks. I was wondering how often masks should be washed and if there is a specific way to remove a used mask correctly.
Yes, Brooke, it all depends where you are. If you are at work or at a restaurant, I would recommend to remove the mask like this without touching the actual face area, because otherwise you contaminate your hands, or when you put it down, you contaminate the surface there. So if you're at when you get in your car by yourself and you take your mask off, it's not such an important factor. So there is something like mask hygiene. We want to avoid touching the mask too much, because some secretions actually, especially when you wear it for an hour or longer at a time, will seep through the material, any material, and there will be a little bit of moisture on the outside potentially, and that could be contagious. So cloth masks should be washed frequently, at least once a day, and then these can be discarded, obviously. But it is important not to touch these facing surfaces because they are contaminated.
Okay, great. Thank you so much. That's it.
Thank you, Brooke. And next up, we're going to Delaney Smith with Santa Barbara Independent.
Hi. So I was reading in the LA Times about how COVID vaccine allocation has been updated so that cannabis employees, whether they're growers or they work in retail, have jumped the line and they are ahead of teachers. They are in phase 1A. Obviously that's LA, but was there, and it seemed like based on your presentation, that's not happening here. But was there any talk of that for Santa Barbara County, or can you speak to that at all of why that would make sense?
Sure. So per CDPH guidelines, cannabis industry employees are included in phase 1A if they are working in medicinal cannabis, and they are included in phase 1B, food and ag, if they are working as growers in production, storage, transport, and distribution. So I checked with our team, and we are not aware of any cannabis workers medicinal cannabis workers who have been vaccinated in our community, our public community sites. That's not to say that they were not vaccinated at any one of our providers.
Okay.
But in our pods, we are not aware of any that approach us as healthcare workers.
All right. Thanks. That was my only question.
Thank you, Delaney. And next up, we're going to Laura Place with Santa Maria Times, who will be followed by Tiffany Haas at KSBY.
Hi, everyone. Thank you. So my first question is about just this prioritization of 65 and up above the other sector workers rather than doing them simultaneously, which I believe when I asked this question last week, it was shared that they would be vaccinated simultaneously, which I know would slow it down for each group. But since they're all in one phase together, that's what was said. So I was wondering why that changed. And yeah, that's my first question.
I can speak to that. 80% of all bad outcomes and deaths with COVID disease are in people 65 and over. So if you look at the big picture, age 65 and older is basically the greatest risk factor, regardless of underlying health conditions or chronic health problems, to have a poor outcome. And that's why with this incredibly stretched short supply of vaccine product, we decided that we going to roll out a couple of weeks later for those folks who are in these industries. But we're really talking a couple of weeks. And
okay. So you think it might be just 2 weeks from now-ish?
Yes.
In which those sectors could
depending
get them?
on supply, but that's our best guesstimate. And it literally really depends on vaccine supply. And as you can imagine, if you open up to 80,000 people, your systems will crash more likely as if you open up to 40,000 people and then wait 2 weeks and open it up again.
If I may add something additional. So even though we want to vaccinate the emergency services, the food and ag workers, and the education and childcare, we're absolutely, again, wanting to vaccinate them. But because of the 6,000 doses a week, it becomes an impossibility. However, I do want to say that that does not mean that we're not planning with our community based organizations, our community leaders, and poised for when we do get more vaccines, how would we roll out vaccine clinics to our ag workers and our food workers and our education and childcare workers, to name a few. So the planning continues, and we are just waiting for more vaccines, simply.
Okay, thank you. For another question, so with the 16 and up age group or group of people that you mentioned who have comorbidities, so just to make sure I understand, were you saying that that group statewide might be moved up, or in Santa Barbara County, they will also, okay.
Statewide, the California officials announced that starting on March 15, statewide, they will be eligible as vaccines are available.
Okay, so, but if the, Blue Shield system is in place at that time, will the county have any say in whether the county will start vaccinating that group, or would it just be up to the state at that point?
Right, you caught a really good nuance right there. So when the TPA, the third-party administrator, Blue Shield, is in effect, then they will manage the allocation and who gets vaccinated, the priorities.
Okay. And then can you clarify on another topic, how many employees currently work in the county call center, and how many you would like to see working there? Like what kind of increase in staffing you'd like to see?
Unfortunately, I don't have that information, but more than happy to get that and email that to you.
Okay. And lastly, do you have any estimate of how many vaccines have gone to technically non-eligible residents just because of the reasons you mentioned, just rarely, whether it's a missed appointment or just to make sure the doses get used?
We're not tracking that, so unfortunately, I don't have that information.
Okay, thanks very much.
Thank you, Laura. And next up, we're going to Tiffany with KSBY.
Hello, everyone. I have one question. When the time comes for those 16 to 64 with underlying health conditions to get the vaccine, will they need to prove their eligibility at vaccine sites? And if so, how? Thank you.
I can maybe speak to that. I don't think the details have been totally determined. They may have to show proof when they make the appointment for the vaccine, because it would be not very humane to send somebody who's in a wheelchair or something away from a site for whatever reason, or somebody who has trouble getting to a vaccination site or clinic. So my understanding so far is that should be checked during the registration process.
Thank you. I think that was her only question. And so last, we are going to Atmika Iyer with UCSB's Daily Nexus.
Hi, I have two questions. My first question is, I know that throughout this pandemic, there has been a lot of talk community-wide about college students and how their partying has contributed to rising numbers within Santa Barbara County. Looking into law enforcement and the county's response to college students' behavior, we found that there's a large education-based approach to violations, with law enforcement saying that generally they give an offender around 2 chances before they choose to impose some sort of consequence. Do you think that that is an effective approach to educate first and then impose consequences? Or do you think that it may contribute to rising numbers?
I, as a public health professional, always believe that we should educate first and then move into enforcement. So I support that strategy. I also support the strategy of UCSB and SBCC becoming also more diligent in enforcing academic sanctions as well. So it will take both. It will take our community efforts as well as the academic institutions' effort. And as well as the college students themselves, in order for us to maintain the traction that we're seeing.
Gotcha, thank you. And my second question is, speaking from the perspective of IV, where there is a large population of college students who are not likely to be eligible for a vaccine until much later, do you think that certain communities, dependent on their demographics, will only have herd immunity later in the timeline of vaccinations? Or do you think communities will catch up and have herd immunity around the same time?
That's a very interesting question. It's very difficult to predict, honestly, unless one designed a study to check for level of antibodies in the community. And yeah, you brought up a very interesting question. It's unfortunately difficult to answer.
But I am hopeful with the federal announcements that in 5 weeks, we're talking about 5 weeks, that vaccine will be widely available to any community member who wants it. So that will mean that hopefully college students too.
Gotcha. Thank you so much.
Thank you,
And-
Dr.
I have the information for regarding our call center. So currently we have 11 working in our call center, and we can have additional 12 that we can bring in to increase our staffing.
And that's in addition to 211.
That is correct.
Thank you, Dr. Dovernoso. And that concludes the questions and today's press conference. The Board of Supervisors is not in session this coming Tuesday on February 16th. So therefore, we will hold a press conference at 4:30 p.m. Tuesday, February 16. For more information and links to the county's public health data dashboard, vaccine information, FAQs, informational videos, and more, please go to publichealthsbc.org, also seen on your screen. You can also call 211, select option 4 for information, or they may connect you directly to the county's call center. Callers outside of the area code of 805 may call toll free to 800-400-1572. So thank you again for your ongoing patience and diligence to slow the spread of the virus in our community. And with that, have a happy and safe weekend, and we will see you all next week.